Every winter, Punjab's air turns grey and dangerous. Cities like Lahore, Faisalabad, and Gujranwala reach air quality levels that are called hazardous by the World Health Organization. Last year, Lahore's AQI crossed 529, and in Multan, it even hit 2000. That's toxic air. And hospitals saw the impact right away. In that month, almost 2 million people in Punjab needed treatment for breathing problems and infections. The Punjab government even declared smog a calamity and closed schools to protect children. Assalamu alaikum, I'm Mahin Azam Khan, and you're watching Front Seat to Climate Change on DawnNews TV. Don't forget the full version of this episode is on DawnNews English. The smog that covers Punjab is caused by many things: traffic, smoke, factories, brick kilns, burning crop residue, and waste. In winter, when the air is still and cold, these pollutants stay trapped close to the ground. Climate change makes this problem even worse. This month of October, we're focusing on the air we breathe. On 11th October in Lahore, Dawn Media Group is bringing together doctors, experts, and policymakers at the Air We Breathe conference under the Breathe Pakistan campaign. So, what exactly happens inside our body when we breathe this air? Let's start with the lungs and see how it spreads far beyond them.
So basically, our lung is the most forefront part of our body that exposed to the air pollution. So air pollution, basically, we should know what is air pollution first. Say air pollution are of various kinds of things. It's a mix of gases, it's a mix of particulate matter. So basically, there are two, three different types of air pollution that affects our lungs, and in which the most important part is the particulate matter, which sizes are less than 2.5 micron. That goes into the deepest part of our lung that we call as a alveoli or air sacs, and through which it can enter into our blood streams as well. Okay, so this is the most dangerous part of the uh, particulate matter, and this is basically produced by the motor vehicles exhaust, the factories, the burns that we burn, the coals and all these things. And this is the most dangerous part. So basically, when it goes in our lungs, it produces various type of diseases in our lungs. So if we start talking from our childhood, so basically our lung grows with our age, and in females, uh, at the age of till the age of 21, and in the male till the age of 18, it continues to develop and grows, in fact. So if it exposed to a air pollution, the development phase also delays. So these children become more vulnerable to develop lung diseases in their life. In fact, in their adolescence ages, in adult lives, and these diseases includes like asthma, chronic obstructive pulmonary diseases, and different types of allergic reactions in their lungs, and they may produce with recurrent upper respiratory tract symptoms like rhinorrhea, sneezing, and further it goes to the lower part of the lungs. So then it produces the wheezing, the shortness of breath, a repeated cough, repeated infections. So, and second population is who has previously diseased population, like those patients who has already uh, affected by various diseases like asthma, like COPD, or they are smokers. So when they expose to air pollution, their diseases become worse. So they develop more frequent exacerbation, or you can say in general word attacks. So they have more frequent attacks of asthma, more frequent attacks of COPD. We label this as exacerbations. So their symptoms is usually not under control, even with some medications, and they develop more severe symptoms. And even then, they required sometimes hospitalization or aggressive management, or they may develop respiratory failure in more severe cases. So they may end up with a more dependency on oxygen and other respiratory supports. So that's how basically this is the basic things how this air pollution affects our lungs. In pregnant females, like the more episodes of premature deaths, low birth weight babies. All these are because of these. One of the factors is the air pollution as well. It has a seasonal variation as well. And whenever there is a air quality get worsens, like in when there is a fog, when there are more smokes, or when there are you can say there are more like environmental things or environmental changes occur. So patients usually come to us in increasing number with lots of respiratory symptoms. And as I told you before, like those patients who has already a disease, so they frequently come to us with a severe symptoms, and most of them requires hospitalization, frequent ER visits, and increase in their medication. So it's seasonal, as well as whenever there is a air quality becomes worsen, so the number of patients also increases in hospitals.
We also saw that last year when smog hit us, especially in Lahore, there was a spike in hospital admissions. Many
Yeah.
people also think that air pollution only affects the lungs, but does it also have an impact on all of our other organs, like the heart or even the brain? Can you expand a little bit about this as well?
Yeah, like I told you before, when there is a particulate matter of less than 2.5 macrons, and this is included in the motor vehicle exhaust, the industrial pollutions, and in a fire. So these low size or a small particulate matters penetrates our blood vessels as well. So whenever there is an increased exposure of these particulate matter, these not only affect the lung, but also affect the heart. It's a cause of a sudden heart attacks. It's cause of a sudden stroke. When stroke is like a paralysis, you can say, and even it's a one of a cause of cancer as well, especially the lung cancer of these small particulate matters. So they can penetrate into the blood, and from blood it can go to other areas of our body, and they can cause diseases there as well, especially heart and brain.
It is also really evident that certain groups seem to suffer more than others. So children and elderly especially are said to be the most vulnerable. What makes them more at risk compared to the general population?
Uh, as I told you before, that our lungs grows with age. So that's how children's immune system, their lungs are not mature. And when they get affected with air pollution, their development phase also delayed, their immune system affected. They got more frequent infections, more frequent episodes of upper respiratory tract infection, more asthma-like symptoms, bronchitis, and likewise in elderly population where our immune system are not very much powerful. So these patients also develop more frequent symptoms, more severe symptoms, and even this is a major cause of death throughout the world. In fact, the respiratory diseases is like COPD is the third leading cause of death throughout the world. Respiratory tract infection in a low middle income countries, the respiratory tract infection is the second leading cause of death, especially in children. So in fact, these vulnerable population, as well as I will also mention, as I told you before, the pregnant ladies. So it's a more important cause of a premature death, low birth weight babies. So they are also, I will include in a vulnerable population, not only elderly and children, but also the pregnant women.
For many people, avoiding exposure is not an option. Rickshaw drivers, traffic wardens, factory workers, they breathe this air for hours every day. What can they realistically do to protect themselves?
Yeah, at least we should educate them to use masks. So even simple mask can protect a lots of things. Does not protect a very small particulate matter, but at least a lots of pollution they can prevent by just putting a daily clean mask. Those are not costly, or we can provide them in different like we are supplying foods to them. So with food, we can offer these simple things to these poorly or a low class, low income class population that you are talking, like a rickshaw driver and these things. So give them a simple mask. Please use it daily, change it. So at least some protection. Number one. Number two, a good healthy diet, exercise, and plenty of water use. And during these seasons, not only use masks but also use goggles as well. So these simple things, I think, for has a large impact at least.
Even small steps make a difference. Wearing a mask, drinking water, and avoiding the worst days outdoors. It's not a full solution, but it can help save lives. Now let's talk about the bigger picture. Just how big is the health burden of air pollution in Pakistan? And why does it get so much worse in smog season?
I mean, I have been doing this, estimation since last many years, in fact, a couple of decades. And I'm not surprised, and you will not be surprised, that about 7 million people globally die of air pollution alone. And that's the biggest environmental health risk globally. Unfortunately, Pakistan is one of those countries which is worse affected by air pollution. And I was a little surprised to see that, this is the number one risk factors for deaths and disease in Pakistan, which is not the case for developed countries. Although it's a global risk factor, the largest environmental risk factor. But for Pakistan, air pollution is the number one killer, for the deaths as well as all the diseases, if you count. So about 235,000 deaths annually alone are occurring because of air pollution in Pakistan annually. So this is the situation. So we talk about like the low birth rate, we talk about malnutrition, we talk about all the other risk factors. So considering all the other risk factors, this is coming as the number one risk factors. And on average, about 4 years are lost of all the Pakistanis because of the air pollution alone. And some of the cities like Karachi, or you talk about particularly Lahore, the lost years about 7 years.
When air quality jumps from poor to hazardous, hospitals don't just get a few more patients, they get flooded.
Hospitals, on an average, and we estimated about a few years ago, that as the pollution goes from 50 to 100 to 200, for example, there's about 20% to 70% increase in admissions for cardiovascular and respiratory diseases for the elderly as well as for the children. So about 1.5 times to 2 times increase in admission which happens. So your health systems are already overwhelmed with the number of admissions, the number of health visits they have. So obviously that gets overwhelmed. So that doesn't provide that. Those are not prepared for this. And I mean, even if they're prepared, we should be rather preventing these exposures rather than we expect them to be in the hospitals and get treated.
As you rightfully said, we should focus on adaptation and we should take preventive measures before, the smog season. Dust that you see is only part of the story. The real danger is PM 2.5. Fine particles too small to see but small enough to travel into your blood and harm the whole body.
So I didn't want to go into this technicality, but it's important to understand that. So when we say particulate matter or particles in the air, so we are talking like 2.5 micron size particles. So these are very small particles. So 2.5 micron is like a large bacteria could be a 5 micron or 4 micron. So we're talking about a very, very small particles. So it's smaller, some of them are like smaller than bacteria, so 2.5 micron particles. So these particles actually have a big health impact. Why? Because it's not just only are inhaled and goes into the lung. Because they're so small, they go through the capillaries into the blood. And once in the blood, it affects the whole body. That's where most of the common people don't understand its impact, because they think that it's just the respiratory tract or the lung which gets affected. It's not. it's the entire body gets affected. So once in the blood, so for example, a pregnant woman is exposed and they're in Karachi or Lahore, so their fetus get exposed to air pollution because through the blood, it leads to low birth weight babies. It leads to preterm birth. It leads to abortions. So those are the evidences that are available. So it goes into the brain and affects the brain as well. So it causes stroke. It causes heart diseases. It causes cancers. So those are the internal, every organ and body systems gets affected once this particulate matter gets into the blood. So these are very, very small particles. So the dust you see, there are many large particles which settles down, but within that, there are small particles, which is 2.5 microns and less. And most of the studies globally, and we have done several studies in Pakistan as well on PM 2.5 microns. So it has a high impact because of its size, because it goes not only into the lung, but goes through the capillaries into the blood and affects the entire body. So, you said we hope that it will not happen. And I'll say that if you'll not do anything, it will happen. So you have to, unless you have taken certain measures, then you hope that it will be, better. But if there is no, management of the vehicles, there is no management of the industrial emissions, there is no management of the stub burning, then it will happen. And how severe it will happen, obviously the climate change is adding this up to that, and we are not sure as how severe it could become. Because sometimes the wind is very low, the wind speed is very low and all of that, so it could become very severe. But unless you reduce your emissions, you can't hope for that. So I think there are very clear, steps that you have to, there are residential sources, there are industrial sources, there are vehicular sources, the vehicular quality, the quality of the fuel, all of those needs to be looked at. And you start with the quality of the fuel, for example. So if you reduce the sulfur content in the fuel, so your sulfur oxides will be reduced. So why don't we go for Euro 5 and Euro 6? We already have 277 or 280 per liter. Per liter is like 280 per liter. So if we add 5 more rupees, and if we reduce the sulfur content of the fuel to Euro 5 and Euro 6, your sulfur in the air will be reduced to a substantial extent. So that's one thing. You're burning fuel, the fuel quality should be better. You're burning in the engine's quality should be better. So then you again need regulations and what kind of vehicle can roam around in the cities or not. So it's a management decision. It's not you need all the new cars. You have to take a management decision as what kind of engines will be allowed in the city in order to reduce the emission, and that can be done in with just one order, and you implement that. So you can reduce substantial amount of air pollution with this just one management and one policy. So these are the kind of policies. Similarly, for the industrial policies, you need to look at whether they have this. So there is an emission, major emission where this is coming from. You have to monitor them, and also there are scrubbers which needs to be installed in each industries. Small and large industries, particularly the small industries, are not using that. So those scrubbers can reduce the emissions to a substantial amount. So these are like 3, 4, or 5 major initiatives which you can take, which can reduce the air pollution to half within a few weeks if you want to implement it. So then you can expect and hope that there'll be, some relief from from climate change and air pollution.
The damage is huge, but it isn't inevitable. If we focus on cutting emissions at the source, we can protect millions. The burden is not equal. Children, the elderly, and pregnant women are especially vulnerable. And outdoor workers, like rickshaw drivers, traffic police, mazdoors, breathe the most polluted air. Those who contribute least to the emissions often pay the highest price.
So, as I said, and these, you rightly pointed out, these people, poor and sad to see these, traffic police, guards, and you see rickshaw drivers, and you see bike riders and other riders who are on the roads most of the day. So it's not just commuting for work once a day, but they are, for the entire day they are on the road. And certainly they are the, worst affected and highest at risk. And we expect these poor people who are actually already, underpaid, they will have most of the risk besides cardiovascular and respiratory disease. They will also have the, cancer risk, and that's lung cancer and liver cancer and all the other cancers which are associated with air pollution. So, unfortunately, these are the vulnerable people, those who are suffering from poverty. They are doing such jobs which are exposing them to the very high levels of pollutions, and then they get sick more often and more severely. So obviously, it's a health burden for them in the longer run. Unfortunately, I have to say that several of them will not only have the cardiovascular problem or the respiratory problem, but they will also have cancer risk and future. And that's kind of devastating, not for the individual, for the entire family, obviously. So they get into more and more poverty.
And there are warning signs you shouldn't ignore.
Yeah, like it starts usually with the very common symptoms, like for example, nasal irritation, rhinorrhea, more sneezing frequency, sore throat. So if we go from the nose to downwards, it shows severity as well. Like initially you just feel some itchy nose, and then runny nose, then some sore throats. That means you are like going to be suffer with some respiratory problems. And then later on, you start coughing, more sputum production, or a shortness of breath, then wheezes, chest tightness. So that increases with the severity of the symptoms. So whenever you start some respiratory problem, you should think that you are affected by the air pollution or some infection. You should consult your doctor as soon as possible. And you should also take the preventive measure, especially in these seasons. So wearing of a mask and less frequently go outside, especially a vulnerable population like elderly or children's, and good healthy diet, uh, lots of fluid, and use medications if you are already using like for some diseases. So you should continue your medicines or consult your doctor for further advices. So you should not ignore these small symptoms, in fact, or these little symptoms, and you should consult your doctor as soon as possible.
For lasting clean air, Pakistan needs better fuel standards, affordable public transport, industrial compliance, and air quality monitoring in every city. We also need regional cooperation, climate diplomacy with India to stop cross-border stubble burning. The Punjab government, with support from the World Bank, has launched a plan to cut PM 2.5 by about 35% in the next decade. But policies will only work if implemented.
Sometimes the government are trying to do some magic, so this is not magic. This is a stepwise systematic effort which is required. So if you just, think of that you will do cloudburst or something like that, rain and all of that, that can reduce the air pollution for a day, not for a sustained period. Okay, so you need to do a systematic effort, look at the emissions. They are coming from the same sources time and again, and you have to do systematic effort and policies in place to reduce this emission. At least you start with few, start with few and see the reduction, and then you take the next steps in the next phase. We're not saying that it will happen, immediately everything will be corrected in 1 month, for example. But at least you start with few things which are low-hanging fruit, which can be done quickly, and then see what you can do in the next 6 months, for example. So and the one more thing is that we are not monitoring our air quality. So we have like embassy, U.S. embassy, has one monitor where the emissions are being monitored. There are better monitors in place in at least in Punjab. So there are some in Lahore and some in other cities also. But in Sindh and in Karachi, for example, there are no air quality monitoring being done. So if you monitor them and then you take intervention and then you monitor, so you can see the difference, what's happening. So we don't know what's the baseline, what is the level, and then whatever intervention you're doing, you're fighting in the dark or fighting in the dark, so you don't know what's working, what's not working. So first thing is you monitor your air quality, and then you take a stepwise intervention to see is there any reduction or not.
I'm Mahin Azam Khan signing off. Until next week, let's fight for air that keeps us alive, not sick.